Okay.
Greetings to all the members of the AIWC who have joined us on this platform and our special guests and fellow travelers of our AIWC, Kerala and elsewhere. It's always a pleasure to see all of you on a platform like this. And since the last 3, 4 years, we have been doing this under various sessions. One of our major sessions was the Literary and the Cultural Forum, which we had been doing for almost over 4 years now. This is another session that we started on achievers and trailblazers, women taking untrodden paths. And this is session 8 for us. So all of you who have joined here would already know that in the past sessions we have had, we had people from aviation careers, we had mountain trekking, we've been looking at, I would say, right from the ground to the skies, as it were, of women entering I would say, professions that are challenging and which are not so commonly accepted and pursued with passion by women. So it's very heartening to welcome Dr. Lakshmi Venkatesh, who has given us a topic titled Helping People Speak, Listen, and Connect: The Fascinating World of Audiology and Speech Language Therapy. If we go back to the beginnings of human speech, we can trace it back to various theories. And most of us realize that at one point of time, uh, the humans did not have a language. Humans spoke in sounds, especially if you remember the African jungles and how they communicated with one another on their drums. It did not have a written language. The written language came much later. Of course, it was an act of imitation, of trying to imitate language in terms of the sounds that we saw around us. But language developed, and each word, each sound began to take on meaning, and groups of sounds took on meaningful, um, what you'd say, communicative activities. And that is what language is today for most of us. But there are many people, many children who do not have the capability to talk, to understand, to listen, and to reciprocate, and to meaningfully be in a social behavior. Now, this is a situation which is becoming very acute today, and more children are becoming autistic. People understand that this is not the normal, but it is autism, and helping people speak is an attempt to bring them into the mainstream of society. It is also a sad fact that these children, coming under different degrees of speech incapabilities, are facing a lot of problems in today's world. To help them to find a meaningful life is indeed a very humanitarian act and a humanitarian challenge for people like Lakshmi to bring them back into mainstream relationships and life. When we talk about phonology and articulation, we remember many, especially literature people like us, remember theories like the poo-poo theory and the bow-wow theory. Both these theories relate to how people imitated sounds. And the bow-wow theory actually is a way of saying that when we produce sounds, in the beginning there was no meaning, but then eventually these sounds began to acquire meaning. So this is the language as it is today. It was not like this at one point of time. And when we think about children who are not in the normal course of communication, we are actually looking at children who perhaps go back in many centuries to be what we were once and what we have now progressed to. So it is in this context, this particular presentation becomes very, very meaningful. And we are very grateful to Dr. Lakshmi Venkatesh, who is a professor from the Department of Speech Language Pathology, Sri Ramachandra Faculty of Audiology and Speak Language Pathology, and the Sri Ramachandra Institute of Higher Education and Research, which is a deemed to be university in Chennai. Dr. Lakshmi has many caps, I should say. She has done extensive research. She has guided more than 20 research students on various topics. Particularly, I was fascinated by the fact when I was going through her CV that Telugu, Tamil, English, all these, the way in which students are able to articulate different languages and how one language helps another language to find meaning. And that is, I think, a novel contribution that Lakshmi is making to this area of speech language pathology. We have heard about bilingualism. We have heard about multilingualism, being able to talk different languages. And I was very fascinated by this notion that when we speak one language, we actually have only one kind of speech or one kind of communication. But when we have different languages, and that is what I think the speech therapy that Lakshmi is trying to do, that how languages help one another in finding meaning for the speaker as well as the listener. Now, prior to her current assignment, she worked at Dr. S.R. Chandrasekhar Institute of Speech and Hearing, Bangalore, Speaker Rehabilitation Institute for Handicapped, Secunderabad, and the Spastic Society of Tamil Nadu, Chennai. So, wide, I would say, research experience and professionalism she has brought to this understanding of helping people speak, listen, and connect. Lakshmi has a qualification that is really, I should say, interesting as well as complementary, because she completed her BSc in Audiology and Speech Rehabilitation from NIJHH, I don't know how that is pronounced, perhaps Lakshmi will tell us that, Mumbai, and MSc in Speech and Hearing from Aish, Mysore. She obtained her PhD in Speech and Hearing Sciences from the University of Washington, Seattle, USA in 2007. In research, teaching, and clinical career spanning 25 years. She looks too young for that, for us to believe that she has really worked for 25 years. She has several publications in national and international journals. And to top it all, when one is very good in one's career, awards and honors come on its own. And Lakshmi has won many honors and awards. She received the Professor N. Ratna Oration Award this year in 2026, awarded by the Indian Speech, Language and Hearing Association. Before that, in 2013, she was the recipient of the Professor Reis Ahmad Memorial Award lecture from the Acoustical Society of India. She was also a recipient of the Aradi Venkataraman and P.D. Manohar gold medals from the University of Mysore. Congratulations, Lakshmi. Graduate School Top Scholar Award from the University of Washington, Seattle, and the International Student Scholarship Award from the American Speech Language Hearing Foundation. So we have today for a presentation as a speaker, a very, I would say, academic and humanitarian individual who has not only pursued her career with passion, but has also worked hard to bring hearing and listening and connecting to many children across India and even in the US. I understand that she now has a clinical and research interest as well, and she's exploring new grounds on child speech and language disorders, comorbidity, language and literary deficits among school-going children. And I think that is the point where the children have to be understood and caught early enough. She has also sponsored a project and completed a DST-sponsored project which looks at intervention programs for children from birth through age 3. And she is particularly interested in developing and implementing low-intensity caregiver-mediated interventions for neurodivergent children. They're all very, very big, high-sounding words. And for the common layman, this is an area that we have not really looked at seriously because in our world, and the normal is the normal. It is when it becomes a little out of the normal, then we begin to think seriously about it. On my own part, my interest in this particular area, and I think with everyone it is like that. As long as it is someone else's, we don't really go deep into it and try to understand it. But when it becomes a part of one's own life, then one begins to show interest. And I think this forum where Lakshmi is talking to us is particularly for the All India Women's Conference, is one which opens our eyes, not just to the smaller nuclear family units, but opens it up for us on a wider platform where we really look at and try to understand those around us. And I'm sure that Lakshmi is going to enlighten us with what we can do as an organization and what we need to know about this particular area of study. More than all that, I would like to compliment Lakshmi for having chosen a profession of this nature and pursuing it with such passion. Not everyone does it, and she is indeed a trailblazer for us here on this platform. So very warm welcome to you, Lakshmi, and we look forward to hearing you speak. I would also like to welcome some of our distinguished guests here. We have our past president, Kalyani Raj. We have our former president and patron, Sheila Kakde, and we have Shikha Mitra, and I think our present president has not joined us.
Jamila Begum, some Jamila Begum is.
Hello. Okay, so I would now request Dr. Kalyani Raj, who has joined us, to unmute and say a few words.
She must be introduced.
Yes, yeah. Welcome and greetings to our forum. Kalyaniji, you're muted.
Can you hear me now?
Yeah, we can hear you now. Yes. Go ahead.
Yeah. Thank you, Jamila ji. And I have attended a few of your this Trailblazers serial, and I mean, all of them have been so good, and we have come to know the background and I mean the expertise of women in that, so far not explored the field and how well they have done in all this field. But I think today's the way what you introduced about Lakshmi, it takes the cake. I mean, as you rightly said, that she has taken up something which we not many people are aware of, and I don't know how many of them are even aware of such issues. Forget about the the solutions part and all. I'm not sure how many are aware. Even probably even we didn't. We knew autism was there. We knew speech therapy is there. We knew children have speech issues, but not the specific. And Lakshmi, amazing background you have. Excellent. I mean, it's so nice to know that you have. Um, when I heard Jamila ji introducing you, reading your profile, it was so good. And I mean, we can't even imagine. I think, it's beyond our imagination. And I'm really looking forward to hearing your real experience and what you have done and how you are doing it. And as Jamila ji rightly said, it opens up scope for AIWC work as well. And it's really good. And congratulations once again to Trivandrum branch and Jamila ji and Usha for selecting such, I would say that, ideal people to speak to us, women to speak to us and introduce us to such fields. Thank you so much.
Thank you, Kalyani ji, for those kind words. Shall we, Usha, shall we now ask Lakshmi to begin her presentation?
Yes, Lakshmi, you can start your presentation.
Yeah, Lakshmi, you can start your presentation.
First of all, thank you so much, Jamila ma'am, for a very, very kind introduction. And I would like to thank first the All India Women's Conference for giving me this opportunity. And it's definitely a big honor to be here. Amidst a lot of trailblazers, if I may say, who are already contributing a lot to the society, and even this effort, I think, is a wonderful effort that you're doing so that young girls can probably choose careers, take informed decisions about careers. So I think this effort is also a wonderful effort, and it's wonderful to be here. And thank you very much. So my main agenda today is to really talk about the profession and talk about the profession that I'm in, and more about what this profession is and how can young girls get into this profession. But towards the end, if there's time for discussion, we can also talk a lot about what organizations like the AIWC can do to contribute to this area in general. And there is so much that can be done by everyone. But we'll keep that for the end. But my main agenda is to really talk about the profession of audiology and speech language pathology. All right, so is my screen visible, just to be sure?
Yes, we can see the screen.
Okay. All right, so as Jamila ma'am said, I will introduce you to the world of audiology and speech language pathology. It's always a matter of pride to talk about the profession that I've chosen and I've been doing for the past 25 years. And currently, as you can see, I'm at the Sri Ramachandra Faculty of Audiology and Speech Language Pathology, and I'd like to just acknowledge my organization, because today I'll be showing a lot of pictures of children and adults which have all come out from the hospital and the center that I'm currently working. Okay, so already Jamila ma'am has set the stage for talking about speech, language, communication. But as you can see, the title of this profession is Audiology and Speech Language Pathology. And so it is an amalgamation of two different professionals, audiology and speech language pathology. And we are talking today about hearing, listening, speaking, and communication. So all these three are very much interlinked, and over the talk today, I will try and maybe unlock how this puzzle really fits in together. We also work with swallowing disorders, and that also I will try and bring in somewhere along the talk. So who are we really? Who is this professional who is called the audiologist and speech language pathologist? So audiology by itself, or audiologist, is a professional who assesses, treats hearing and its related problems. So that is a whole spectrum of work that we do as audiologists. So there is the inner ear, middle ear, and there is a whole lot of things that happens with the ear. Speech language pathologist, as you can see, this is the entire picture of head and neck. is the professional who evaluates and provides intervention for speech, language, communication, and swallowing problems. And in India, now when we do the degree of audiology and speech language pathology, we do it as a dual degree. And when we do the bachelor's degree, we get the title of audiologist and speech language pathologist. Okay, so this is just to kind of connect the hearing and the speaking part, right? So as you can see here, this is the sound waves are there, in the environment, and we hear it through the ear. Once we've heard it, the brain kind of makes sense of what we hear, and then we may also want to say something, we may want to convey something, in which case the brain is telling us, we have thoughts, and then we convert that into language. Language could be any language, Telugu, Malayalam, Kannada, any language, but we convert into words, sentences, words, and then finally into sounds, and those sounds go through the motor nerves, goes to the muscles, and then speech is produced. So there's a lot happening here. So hearing, and then we are making sense of what we are hearing, we are trying to produce speech. Now, a child who has possibly born with hearing loss, so this is the listener end of it, and if the child has born with a hearing loss and cannot hear these sound waves coming into the ear, as you can see in the listener end, right, he cannot understand what is being spoken. And so this going back to the speaker end, he's not hearing anything, will also not learn to speak. So there's a big connection between the hearing and the speaking. And so that is why this is a very interconnected profession that we are doing together. So this is the typical speech chain where the speaker and the listener are connected, and there's lots happening in this two-way communication between the speaker and the listener. So while we understand now the connection between hearing and speech and communication, there's also this puzzle of language. If you see, we also have the term speech language pathology. So language includes all the components of words, sounds, meaningful sounds, words getting connected into sentences. And language can be different languages, and then language can be communicated through speech, or language may also be communicated through signs. So we also have the sign language. So you can have verbal output, which is speech, and you can have non-verbal language, which is communicated through sign language. So it's not necessary that everybody has to speak to communicate. We also have written language, right? So there's spoken language as well as there's written language. So here we connect speech and language together, and use all of this to kind of communicate. So we communicate using verbal communication as well as non-verbal communication. So these are all the areas that we are working in, and these are all the areas also that kind of go wrong or can get disrupted in certain individuals, children as well as adults. So broadly, we have the concept of communication, and then we have language, and then we have speech inside. So this is the interconnection. Over the years, this profession has also begun to work with balance. So audiologists also work with hearing and balance because it's the same similar anatomical regions, and the physiological mechanisms are in the ear. And speech language pathologists have started working with swallowing and feeding over the years. So although these terms balance and swallowing are not there in the title of the profession, these are also areas that we work with over the years. So I've just put out a lot of movies here. Over the years, a lot about our profession and what we do has really come out from these movies. If any of these are familiar, these movies have shown several aspects of audiological difficulties, speech language difficulties, and areas that have brought some awareness to general public. Mostly right, but there can be some misconceptions also. But as you can see, the Tare Zameen Par was one of the first ones to kind of show learning disability. So we work with King's Speech was about stammering or stuttering. So we work with a plethora of individuals with challenges in speech, language, and communication. And sometimes these movies have kind of spread awareness about the nature of work we do. So, whom do we help really, right? So, as audiologists, we work with congenital and acquired hearing loss. So, by the end of this talk, I'd also like to spread some awareness about early identification and early reference. So, it is really important that we identify these challenges early on so that intervention can be done well. So, in audiology, we work with congenital, that is hearing loss from birth, or acquired hearing loss. Hearing loss can also occur any time during the lifespan because of several medical conditions. Hearing loss can happen due to noise exposure. There is this we call it tinnitus. It's a technical term, but that is the ringing sound that we hear in the ears sometimes. We have something called the auditory processing disorders, which are person can hear, but person is not able to understand what is being heard. Then there's balance disorders, which are vestibular disorders. Cochlear implantation is a procedure done to facilitate hearing, and hearing aids also are given to facilitate hearing. So audiology works with all these people. And speech language pathology works again with a range of conditions, from children to adults. And I've just put some terms here. We will come back to this again. But we work all the way from newborns to elderly. So the lifespan approach is something that's very, very gratifying in this profession. So we work right from the time the baby is born uh, till even end of life considerations. So uh, the 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 range of people we see spans the lifespan. So here I'm just quickly giving some pictures to show the nature of work we do. So this is hearing. So as we can see, audiology, we do a lot of assessments. So this is the hearing screening being done for a newborn. In the first picture you can see. So we can see assessments being done. So there's a lot of technology involved in doing these assessments. So we find out at what level one can hear and where the hearing difficulties are. And the beauty is that this can be done at the time the baby is born itself, and we are looking to really spread the message of newborn hearing screening so that we can identify this as early as possible and then start the habilitation process. So this starts from newborn, but it goes all the way up to elderly. So identifying hearing loss is the first step, and then we need to fit a hearing aid, which you can see here, hearing aid device, or a cochlear implantation is another form of rehabilitation that happens for persons who have difficulty hearing. But just fitting the device or fitting the implantation is not enough. Children typically have to undergo a lot of rehabilitation after the device or the cochlear implant is given. So this is the component of listening. They can hear the sound, but for them to make sense of the sound, we do a lot of rehabilitation where children are taught to listen, right? So I think all of us know the difference between hearing and listening, and we're always sometimes telling each other, that you're not listening, right? So this is the component of listening, where children have to be taught to listen and understand words. And as they listen, they learn the language, they learn words, they learn the sounds, they learn to put together words into sentences, and then they go on to communicate meaningfully like children of other children. So this is a whole process that happens. So the professionals who are audiologists do both hearing assessment and this process of rehabilitation. So the key point here is, as early as we can identify a hearing loss in a child, that is definitely going to give us better outcomes. And how intense we are able to provide rehabilitation will also lead to better outcomes. The other big area that we work on is the field of speech language pathology. And as you can see, this picture just to show the range of conditions that we work with, again, from toddler, infant, all the way up to geriatrics. And I'll just give some examples here of the challenges people may have and whom we can help as audiologists and speech language pathologists. So, language doesn't develop on its own. So, children are playing, children are learning language during this toddler period, and some children are not able to do that. Like is the typical development, and that could happen because of various reasons, and Jamila ma'am already told us about the epidemic of autism that we are seeing now, but there are several reasons. So some of the conditions we've heard maybe are autism. Some conditions could just hearing loss, as we said, hearing loss will lead to difficulty in learning language, difficulty in talking. There are other conditions like attention deficit hyperactivity disorder. There are several other neurodevelopmental conditions that may disrupt this process of learning language and child learning to speak like any other child. So these are what we see in the toddler age. And then a child who's had delay in language development goes on to also possibly having difficulty or is at high risk for having difficulty in school, reading, writing. So again, Jamila ma'am talked about written language, written communication. So there's a very big link between spoken language and written language. So we also work with children with learning disability, dyslexia, and help them do well with language and then also do well with written aspects, because there's a very strong interconnection between spoken language and written language. There are also other conditions that people are familiar with, which is related to speaking. So, stammering, any kind of a voice problem, if the larynx is affected, or articulation or speech problem, where the child is speaking but the speech is not clear to other children or other adults. So, that is articulation or a speech sound disorder. So, our job really is to tease apart where the difficulty is with speaking and where the difficulty is with language, and then the intervention will happen accordingly. As we go into adulthood and geriatrics, so several conditions that we work with are due to traumatic brain injury, stroke, people who have stroke, people who've had head and neck cancers, and because of which the voice is affected and the swallowing is affected because they've had to have a laryngectomy or surgical removal of some structures. So we work with persons with head and neck cancer, neurological conditions, neurological disorders such as the Parkinson's disorder or the Alzheimer's disorder, and we work with persons with dementia. So as we can see now, the the field of speech pathology is going into even end of life care and palliative care as we work with swallowing disorders. So helping elderly, helping persons with neurological disorders swallow safely. So there's a lot that we do even at this spectrum of the lifespan. So again, these are all conditions for which there's lots that can be done, and intervention definitely helps the brain, the neuroplastic brain, to improve, and skills can be improved considerably with intervention. So this is the whole spectrum of work or people whom we work with in speech language pathology. So as I show here, some pictures of this is in a neonatal intensive care unit where we are working with a newborn, develop breastfeeding skills, develop feeding skills. We are also talking to mothers and parents about how to talk to the child, how to communicate with the child, and we're working with children. So there's a lot of course, identification and assessment, but the real work is therapy, where we are helping a child navigate the language, navigate and communicate. So the focus is really on communication, two-way communication. So the key here is early identification. Again, I want to emphasize that because interestingly, whether it is autism, whether it is any of these other neurodevelopmental disorders, the key early signs that we see are many a times linked to speech and language. So for example, we say by 1 year, we know child has to walk. So we can identify motor development. By 8 months, we say child should be able to turn their head and localize sound from where sound is not coming. So we should be able to identify a hearing loss really early. Similarly, by 18 months, we say child should be communicating using words, at least be able to say 5 to 10 words by 18 months. And by 2 years, we say child should be able to combine two words together and say by 2 years. So very easy, 1 year, one word, 2 years, combine two words together. So if a child is not able to do these, then definitely an early referral and early identification helps, and that helps us in doing the intervention as well. So again, just some pictures to show you the work we do with the elderly. We work in the hospital setup, hospital wards, and with again speech, communication, and also swallowing. So there's a lot of now in the past few years, there's a lot of focus in medical speech language pathology. I want to highlight this because many youngsters today are fascinated by being able to work in a hospital setup, especially I must say many who um, feel that they wanted to do possibly medicine and then they came into this field. So there's a lot of work that we do in hospital setup as well. A lot of this instrumentation and the assessments that we do involve work with medical professionals. So this is, for example, modified barium swallow is some swallowing assessments we do with radiology team. This is some assessment, stroboscopy, some assessment we are doing with the ENT professionals. So this branch of medical speech language pathology is also developing very much in India, and there are youngsters who want to work largely with adults. So it's not only children, there's a lot of work that happens with adults as well. So as I said, we work very closely with medical professionals and with a lot of allied health teams. So all these medical professionals like ENT, pediatrics, neonatology, neurology, oncology, a lot of work with head and neck cancers, and of course, a lot of allied health teams like physiotherapy, psychology, occupational therapy, and special education. So this field works very closely as part of a larger team working for the child as well as for the adult. So teamwork really works when we work together. So we don't work in isolation at all. And the center of all of this is the child or the person and the family. So we're working with the families to make it better. So I want to also talk about so there's speech, there's language, but we believe that communication is for all. So we really work to improve communication, right? So this is just some pictures to show you that if a child is not able to speak, there are other ways for the child to be able to communicate, and that is also something that we do. So for example, here on the leftmost picture, you can see a child is pointing to a picture on a tablet and he's communicating through that. So this is also something that is very important. Child may be able to communicate by pointing to a picture book and be able to communicate their needs. And in fact, these methods can help child learn several components of language and really communicate, and that's really what matters. So this is also some work that we do. So we do across lifespan. Again, an adult who has had a surgery or is not able to speak, uh, or who has had a damage and stroke and not able to speak, may also communicate through a picture book or a communication book. So the focus is really on communication, and speech is just one part of it. And this is just a range of community work that we do, not just children, adults. So there's a lot of community work, advocacy work that speech language pathologists do. So we work with professional voice users like singers, teachers. Uh, there's a very big area coming up as accent modification. We work on school awareness program, early identifying children in schools. We do noise awareness programs in community. So again, range of work in community. So it's just not inside four walls. So community-based services are a very major part of our work, where we do screenings in the community, and so we really want this to go down in the community till the frontline worker. So that is just the nature of people we help. Uh, what kind of work we do. So as that is the largely the clinical work that we do. As I said, the clinician does all those work. We work with all these people. But apart from that, there's the scope of this profession is, of course, the academia or academician, which I have chosen to be part of. But at Ramachandra now, I wear all these four hats as a clinician, as an academician involved in training of audiologists and speech language pathologists, a researcher, and an administrator. But one can choose to be any of these. And where are the jobs? The jobs are there in government agencies, health departments, hospitals, and healthcare institutions. And as I said, healthcare institutions can range from now there are a lot of elderly care centers that are hiring speech language pathologists as there is more and more awareness. There are hospitals, there are clinics, there are rehabilitation centers for children and adults, even rehab centers for adults, like the stroke rehab centers are coming up. Then there's private practice. So this is the major benefit of this profession, that you can choose to do your own private practice and be an entrepreneur and actually give jobs to others as well. Then there's academia, there's universities, institutions, then there's industry, the hearing aid industry, cochlear implant industries, schools, both mainstream schools, as the awareness for neurodiversity increases. Many regular schools, mainstream schools also have taken up inclusion, and so there are speech language pathologist posts in schools, both mainstream as well as special schools. So why study this program? It is recognized by the Rehabilitation Council of India. So this is a very regulated program in India, just like the medicine is regulated by the NMC or the National Medical Council. You have the Dental Council of India. So it's similar to these other professions like the Nursing Council of India. We have the Rehabilitation Council of India, which regulates this program in India. And regulation has been very, very good, because there's a uniform curriculum that's followed across the country, and there's uniform requirements for running this program in the country. It's a highly employable degree with 100% placement. There is scope for higher studies, and as I'll talk about that in a bit. And the major one is there's opportunity for entrepreneurship and leadership. And we serve people with speech, hearing, and swallowing and communication problems of all ages. So this is one of the major reasons why I would say that youngsters can possibly consider this profession. So in terms of plan of study, we do, there's the undergraduate program, which is the bachelor's program in audiology and speech language pathology. It's a 4-year degree. It has 6 semesters and a 10-month internship. So 3 years, which is 6 semesters. And then there's a 10-month internship that they have to do where they're fully in the clinical area. Then there's a postgraduate specialization. So while in the bachelor's, you do both audiology and speech language pathology together. In the master's, you do either MSc in audiology or MSc in speech language pathology, which is a 2-year program or 4 semesters. And then you have the doctoral program. So briefly, just the eligibility. It is currently physics, chemistry, and any of these following subjects that you should have taken in the 12th standard. This is the requirement. So yes, we do need to have the science background. And this is also mandated by the Rehabilitation Council of India. So I have to mention that all the information about the program, the degree, is available at the Rehabilitation Council of India website. And if there's time, I can show this briefly. But everything, the institutions which have recognition for running this course is also available on the Rehabilitation Council of India website. So if students have to decide where to do this program, they should go to the RCI or Rehab Council of India website and look for the list of institutions, RCI approved training institutes, right? And so this entire list is available. They just have to go into the list and search for BASLP, and they will find the information. And they will also find information on the earlier recognition of that institute. So it's best that students take an informed decision about where all these courses are run, which all colleges and institutes are running it, and where to do the degree from. So there are both government and private universities which run government institutes, as well as private institutes which run it. And all the information is available on the Rehabilitation Council of India. There is also the Indian Speech Language Hearing Association, where anyone can go and find information about our profession, audiology and speech language pathology. And the best thing here is that you can locate a professional. So if you're looking for a speech language pathologist in your area, you can actually go look and find a speech therapist there in a particular city or in a particular state, or you can get some contacts and then further leads from there. So a lot of information is also available and the Indian Speech Language Hearing Association. Very briefly, in last two slides, I just want to talk about my alma mater. I did my professional journey started from the Aliyavarjung National Institute of Speech and Hearing Disability in Mumbai, a government institute which has centers in 4 different parts of the country, at Delhi, Secunderabad, Kolkata, and Mumbai, where the program BSLP program is run in all 4 cities. And then I went on to do my masters at the All India Institute of Speech and Hearing, Mysore, and then a PhD at the University of Washington, Seattle. And briefly in the middle, 1 year I worked at the Spastic Society of Tamil Nadu, Chennai. My professional journey, which has been very, very gratifying. I started off at the Swika Rehabilitation Institute for Handicap at Secunderabad and the SR Chandrasekhar Institute of Speech and Hearing at Bangalore. Both these centers were training institutes and had excellent clinics. But then I joined the Ramachandra Institute of Higher Education and Research, which is a deemed university and has a hospital setup. A lot of the hospital work that I've done has been in the past 11 or 12 years. So thank you so much. So that is my Ramachandra family right now there, my students and my colleagues. And a lot of what you saw today came from my institute. So again, thank you very much for this opportunity. If there is time, I will talk about some, definitely I'd love to talk about how AIWC can chip in and how you can contribute to spreading awareness about audiology and speech language pathology, spreading awareness really in the community. But my talk largely was geared at getting youngsters motivated to join and spreading word about the profession. So thank you.
Thank you, Lakshmi. That was a very interesting and very informative presentation that you made. There was so much of clarity and so much of information that you put into it. Sort of makes us think about this branch of should be made more general so that people. I think somebody has not switched on. I think this is a branch of study that more people need to hear about, because a lot of us are ignorant about what is being done in this particular area of study. Now I would like to open up the forum for discussion, and I would request our patron Sheila Karthik to say a few words.
Yeah, Lakshmi, you can stop sharing.
Jamila ji.
Yeah. Sheila ji.
Wonderful, wonderful Trivandrum branch. Usha ji, my God. We knew about, only speech therapy and deafness, autism, all that. But the depth of knowledge Lakshmi ji has shared with us is amazing. And thank you very much, Usha ji, Jamila ji, Vijaya Lakshmi ji, for bringing out this information to AIWC. And definitely, I feel ki we should take up any help from Lakshmi ji to develop some program for the deaf and dumb people. Even the children and the elderly citizens who require help. They do not know. They just know that only hearing aid is to be used. And further, any help we can get from such expert, we must discuss with Lakshmi ji and we, develop some program. Lakshmi ji, congratulations to you. And I really felt that you are a gifted child of God to serve His children, and you are doing it very well. You are doing it extremely well. Thank you very much for coming to our program and giving us this knowledge. Ushaji, you have to spread this, spread the video on the national group, all the
Yes.
zonals also, and we can. Our president is busy today, but definitely we can introduce some program regarding audiology and what we can do. There are a lot of people who need such guidance and help. Thank you very much.
Thank you, Sheila.
Thank you, Shilaji. We have two comments that have come up in the chat box. Kalyani Raj says, very interesting topic and excellent presentation, Lakshmi. Crucial issue pertaining to wide spectrum of age and condition. Unfortunately, I have to leave, but may reach out to you for clarification on acquired hearing loss. Thank you so much. Ushar Menon says, congratulations, Lakshmi. Very informative session. Thank you. So that's from the chat box. So back to our live session. Yes, Guneshri wants to say something. Yeah, go ahead.
Yeah, actually, this subject is very, important in my life. Firstly, because we means myself and my husband, we are both, involved with one trust. We are sort of running a trust, and that is for persons with disability. And this RPD Act contains one of the disability is this speech and language disability, autism, and all that. So actually, the trust we are running has got these days girls who have got speech and hearing impairment, and they are coming there to learn tailoring. So they are self-sustaining. They are doing a lot of stitching and all that. They have been taught, and at least 14, 15 girls are coming daily. And when you go to the trust building and, when you interact with them, we feel so satisfied. We feel so happy seeing the happiness. They have no qualms of not being able to hear or, speak. They are happy in their own world. All those 14, 15 girls conversing with each other with the sign languages. And we also go and, we try to talk. That's a very satisfying thing. That's for one thing which I was remembering, and, I was feeling about. And we also want someone who can guide us in these sort of things. Sometimes we will be having a skill development center very soon there. So we might need your help, ma'am, for that also, some advice and all that. That's one thing I wanted to say. And personally for me, I'm a person who had a sudden sensorineurolytic SSHL, hearing loss. Sudden, Ushaji knows that face. Just 1.5 years back, my left ear totally blank, gone, and I could not hear anything. But I went to the doctor immediately, and with the infusion of that what is not cortisone, what do you say is steroids injection, yeah, intravenous for 4 days continuously, I got back my hearing. That was a magical sort of thing that I got with God's grace, I should say. But even now, I have a problem. Not mine is, but I went to for that cochlear implantation is required or not. I went just last week. I told Ushaji also I went last time, but they said even hearing aid is not required. I should not use hearing aid also. I was very disappointed because mine is at the 35 decibel only. I mean, 35 decibel. If it is 80 or 75, they recommend. So I was very disappointed. I wanted a solution for my problem.
You should be
Anyway,
happy you don't need.
no, I was not happy that I don't need, because I'm finding it difficult in meetings and all that to hear. I'm not able to hear when 4 or 5 people talk together. So I have a that is creating a lot of confidence. I'm losing because of that when I go in a group and all. So I wanted a solution, easy solution, but
Solution, I'm sure. We will take this offline, definitely. So, what
Anyway,
matters really is quality of life.
yes,
So,
pardon?
what matters really is
yes,
quality
go
of
ahead.
life. we can find a solution.
Actually, Ushaji also told me that we can contact you for, some sort of solution. But the audiologist had given me a lot of confidence. She said, you have to live with it. You have to try and listen more. You have to sit near the speak. All the things I'm trying to get through that. So that is why I was really happy to hear you, and I hope some solution will come. Yeah,
Thank
it
you.
was very nice.
Also for sharing about your NGO. Thank you for sharing about your work related to trust. And yeah, so that's a whole lot of children grow up, adolescent, adulthood. Then there is a lot of work that has to be done with uh, people with neurodivergent needs. So I think you're filling that space of vocational training, giving adult livelihoods, independent living. So that's also a big space. Yes. So thank you so much.
Yeah, okay, thank you.
Thank you. Anyone else would like to? Teresa, Susan?
She has just joined, I think. She came late. She came
I
after
was
some time.
actually, it's not a question, but it's a clarification I would like to have from you. You talked about swallowing disability, that, where you have some thyroid surgery and then you have this. What is the percentage of getting back voice after this surgery, or it's only partial?
So definitely there are very good outcomes. We can get very good outcomes. So we really need. It's a very common
Yeah.
surgical complication, I may say, and people may the vocal cords may get affected, and hence there can be damage to voice as well as swallowing. But there are ways we can identify where exactly the difficulty is. There are some medical interventions as well as behavioral voice therapy and swallowing therapy to actually be able to have a safe swallow and get the voice back as well. So intervention definitely helps them.
Yes.
Yeah, definitely.
Thank you. Someone who's on Samsung. Usha, you're muted.
Yeah. So,
Anyone? I'm sure that way, because this will go on YouTube, there will be a lot more viewers, because I'm very, very interesting subject. And I must say, Usha, you are blessed to have a daughter-in-law like that.
oh, thank you. Thank you. Yes, we are very proud to have her as part of our family.
Yeah.
Actually, Ushaji had suggested that I should consult you when my problem was there. I'll be definitely consulting you. Yeah.
Yeah, Usha referred me to Lakshmi, and I did talk to Lakshmi once. That time you were in Bangalore, I think.
Yes.
It's only a few years since you moved over to Chennai, or?
It's been a couple of years, ma'am, now. Yeah. So yes,
Anyone?
definitely we need more awareness on early identification and intervention. So like just I think everybody needs to come together, the society, the community, the NGOs, the government. So we really need to get to early identification and to be able to provide services early. So that really helps with wonderful outcomes.
I think we
I know,
can
because
suggest to our
there
head
is no
office
cure.
to include this awareness also along with the awareness programs that we have been doing. I don't think we have been
Yeah.
focusing on
Yeah.
hearing disability. We can suggest to them and even hold health camps where we can get the local people to come and get their hearing tested and help in identification. I think, as you say, there is a lot of requirement for spreading awareness.
Yes.
We'll
So
immediately recommend to our head office to include this also in our awareness programs and the health camps.
So the government itself is embedding these in already existing health programs like the immunization camps. So there are a lot of government programs on early identification itself. So we just need to take some of those sections and just support the government in some of these endeavors. So the Rashtriya Bal Swasthya Karikram, the RBSK or the Rashtriya Bal Swasthya Karikram has already got a wonderful system for early identification of defects, birth deficiencies, and developmental delays as well. So we just need to take these modules, already existing modules, and just start supporting these government initiatives. And so wherever already existing health work is happening, this work can also happen for early identification.
Yeah, I
So,
was wondering about
are
this
NGOs
awareness.
included in these schemes? Can NGOs have a role?
Yeah, so there are already a lot of work the government does in connection with the NGOs. So a lot of the district level early intervention centers will be connected with NGOs. So the Anganwadis, of course, are the frontline force for the health. So they would do the screenings, and then there is a system of screening alone. Identification is not enough, so they have to be connected to centers where intervention and therapy can be given and guidance can be given. So so I'm sure you can uh, network and embed this in already existing programs.
We'll explore the possibilities. And so, Kripa Shetty ma'am has joined from Mangalore. Kripa Shetty, would you like to say something? Please unmute. She is the vice president based in Mangalore. You're muted. Paji, you're muted. Please unmute.
Yeah, from Mangalore. Yeah, ma'am, I was interrupting you in the middle. I wanted to say something. Uh, I'm very happy to be the member of one of this meeting. I really give my respect to Kalyani ji, Usha ma'am, Lakshmi ji, Sheila Kakade, Jamila ji, and Shika ji. Everybody, I really respect them, and I really heard their speeches, and I was very impressed. The speech was so good because I was one who was suffering from hearing aid, like Bhuvaneshwari ji. Even I lost one of my left ear because,
Oh,
well, not left, right ear because of severe this vertigo problem.
oh,
Because of the severe vertigo problem, I'm lost one of my ears. Now I'm here. I have to use ear aid for the right side, but I usually don't use. I'm little lazy. But that's why I was very happy to hear all these messages from you, ma'am, and all the institution where they go through all. I saw it and I was very happy, ma'am. Thank you. And I was happy being the one of the member in this meeting. And I'll really remember these all. And we're grateful to all these great people of you who have been sitting and giving your opinion. I was very happy to hear it, ma'am. Thank you, ma'am. Thanks a lot.
So you can also help us take up with central office for including this in our programs, in our awareness programs and our health programs. So
Okay,
please
ma'am. Definitely,
recommend to
ma'am.
central office. Yes,
Okay, ma'am. But you give me the message of it. I can forward it if you.
I'll do that. I'll do that.
Okay, ma'am. Thanks a lot, ma'am. Thank you, ma'am. Thanks a lot. Okay, ma'am.
So shall we conclude now, Jamila?
Yeah, yeah.
Yeah. Because
So this time we did not have too many members online, but I'm sure that more people will join and listen to this because I think this is a very interesting session that you gave us, Lakshmi. Actually, made us aware of so many things that most of us don't really think about. Maybe it is an eye opener for a lot of us to realize that there's so much of that there are so many people and so many young children, so many old. It's across when you showed that map, which said from early childhood to old age, uh, the uh, the various kinds of difficulties that people face. It's a world where we can really walk into and give a helping hand. And I'm sure that AIWC will attempt to do that. Once again, thank you very much, Lakshmi, for that very, very interesting talk. And I will catch up with you sometime. I would like to talk to you. I'll get you. I already have your number, so I will talk to Usha about that. And Usha, once again, thank you for bringing such a interesting speaker to us and exploring a new subject area that we had not really thought about. And it would be a good idea actually to continue this particular session where Lakshmi can come in again and perhaps advise us as to the ways in which we can actually move forward in helping the needy. I think that is another session that we can look forward to. I hope Lakshmi will say yes to that and come and join us.
Definitely.
Thank you very much, Lakshmi.
Thank
Thank
you.
you, Usha. Thank you
Wonderful
very much.
opportunity. Thank you.
I thank all of you for joining this session, and I hope you will spread the word and make this on our YouTube link available to lot of young girls who can go through it. And I'm sure many of them would be interested in joining this course. And one of the main highlights of what Lakshmi told us is that there is 100% placement. I think there are very, very few courses in our country where the placement is 100%. So that will be an attraction for young girls who are looking to get a degree and get into a job quickly. So I think all of us should try to make this YouTube link available to all the youngsters in colleges, in other institutions, and in our school programs with the +2 children. I think all of you will make the effort and do that. So I thank all of you for joining this session. Thank you, Lakshmi, for sparing your time and making such an excellent presentation. Really proud of you. And thank you. Thank you for joining. And we'll end the session. We'll come back with another interesting career option next month. And in between, we'll also be having sessions of the literary and cultural forum with more interesting topics and more interesting people. Thank you.